So we touched a little bit on radiation, and can we talk a little bit about partial radiation? I mean, that's something you're
Sure.
hearing often, more so than not. Can you
Right.
talk a little bit about
Right.
that?
The standard way that radiation therapy has been delivered over the last 30 or 40 years has been whole breast radiation therapy. So remember, the old standard treatment for all women in the 1960s, for example, would be a mastectomy. When the lumpectomy started to be done, whole breast radiation therapy was used, where radiation beams were aimed at the whole breast. And even with that form of treatment, there have been so many advances over the last 30 years because radiation oncology directly benefits from improvements in imaging, such as CAT scans, as well as software, the computer software that we use to do our very complicated treatment plans that deliver the dose of radiation very safely to the breast and keep the normal structures in the body very safe from the radiation. So it's a very, very safe form of treatment. You mentioned partial breast radiation therapy, and that is currently being investigated by cancer specialists. There are a couple of protocols or trials that we have open at our cancer center. One is a national trial and one is an in-house trial that we have where we're investigating whether we can deliver radiation therapy in selected women, and women who are good candidates, who have smaller tumors, to the lumpectomy site after the surgery has been done, plus 1 centimeter around the lumpectomy, but not to the whole breast. And of course, we're doing this on protocol, where all of our patients who have this treatment done are followed. And of course, the initial results are very promising, but we wait on something like this and make sure that it's safe over a long period of time.
You know, this is a good time to actually talk a little bit about what we're providing coming up here at Illinois Masonic Hospital on Saturday, October 3rd. We're asking any women who want to come in and join us for a free breast cancer education seminar and free clinical examinations can join us on Saturday, October 3rd from 9 to 1 with Hispano Care and Illinois Masonic Medical Center and the Critical Cancer Center on this day. Seating is limited, but if you call 296-7157, that's a 773 area code, or the 1-800-3-ADVOCATE, that's 1-800-3-ADVOCATE, or 1-800-323-8622 on Saturday, October 3rd. Join us, and we're going to be doing lecture. We're going to be talking about prevention, education, and we're also going to be doing free clinical breast exams with attendings.
Yeah, it's a wonderful thing, and it's a great way to also just become informed about the issues and what's available. We're lucky because in our country, screening programs are offered for cancer that give us the ability to detect cancer early. But when there's a lot that you can do to cure the cancer so that it will never come back.
Right.
And so why delay? Why not get informed about it?
Yeah, and the key is prevention.
Yes, absolutely.
Now, this program is bilingual, both in English and Spanish, so please join us. Our lines are open. If you have any questions, please call us at 312-738-1060. Now, Doctor, what can women do to prevent cancer? I mean, you know, we talk about all kinds of things, but what can they really do to prevent it?
There are many things that we can all do to prevent cancer, and in fact, more than half of cancer is preventable. For example, not smoking reduces your risk of developing many, many different forms of cancer. Now, with breast cancer itself, one of the great ways of preventing cancer is to lead an active lifestyle and not be obese, and eat healthy foods that are low-fat type foods and not very high in animal fat. So that is a way that we can reduce a risk of breast cancer. Going to screening when it's time to have your screening done is an important way to not only detect cancer early, but also prevent it, because oftentimes mammograms will pick up something called in situ cancer. This is very early cancer, often staged as stage 0 cancer because it's very early. That is a kind of breast cancer that does not have a chance to spread. It hasn't spread through the basement membrane, doesn't spread to lymph nodes, doesn't spread to distant sites. If you can catch that on a mammogram, often years before it has a chance to develop into an invasive cancer, that can be treated effectively, and you can lower your risk of developing breast cancer.
Doctor, we do have a caller, so let's take that call. Caller, you're on the air.
Hi. I was wondering if the doctor could explain the relationship between drinking out of plastic water bottles and the connection it has to breast cancer.
Well,
thank you, caller.
So I would assume that you're referring to some pollutants that might exist in the plastic water bottle. Now, I went on the American Cancer Society website, and I think everybody is welcome to do that at www.cancer.org. And I looked at the American Cancer Society website at what is considered a risk factor for breast cancer. Of course, that was not one of the things that is a definite risk factor for breast cancer. There are many things that are sort of being speculated on right now, but I think that we need perhaps more information on whether drinking water out of a plastic water bottle would cause breast cancer or not. I am not aware, I'm sorry, I'm not aware of any data to confirm that, but that may simply be because I'm not aware of it. So.
Well, caller, I hope we answered your question, but I know that that's something that information is actually floating out, because I've heard that too, most recently.
Yeah.
And it's kind of pretty interesting that she brought, I'm glad the caller brought it up.
And I think that going to the American Cancer Society website, which is a free resource and one that's available for all of us at cancer.org, and finding out information about breast cancer.
And that's always
updated. They have a nice web page that lists sort of the common risk factors. For example, one of the most common risk factors, we don't have time to talk about all of the risk factors in detail, but one of the more common risk factors for breast cancer is exposure to the hormones estrogen and progesterone, which can, for example, happen if you have experienced your menstrual period earlier than average, or menopause later than average, so that you have an extended period of time when your breast tissue is being exposed to estrogen progesterone. So that is a known risk factor for breast cancer. There might be others that are being speculated on, and I certainly am not an expert. How does
breastfeeding tie into that?
Breastfeeding, I think not breastfeeding may be a risk factor. I'm just not sure. I don't want to speculate. Yeah.
Well, that's good to know. Obviously, the key again is prevention.
Yeah.
Obesity.
Absolutely.
Diet, exercise.
Right.
Prevents everything. You can stay healthy from head to toe.
Right. And obesity does change your hormonal milieu, which exposes your cells to more estrogen. So, for example, obesity is also a risk factor for endometrial cancer, which is a gynecological cancer that can happen in women because the lining of the uterus, the endometrium, is very sensitive to estrogen. And when you're obese, the fatty tissue does convert more into estrogen. So,
Doctor, can we talk a little bit about, or a lot about, how do you foresee cancer being treated 10 to 20 years from now?
Well, we talked about the last 30 years and the fact that there's been more of an emphasis on less debilitating treatments and more of an emphasis on quality of life. And I think that emphasis will continue. Certainly cure rates are climbing in terms of breast cancer, and breast cancer, when it's caught at early stages, is very curable. However, I think that we're all also focused on making sure that we preserve the quality of life of our patients when they're treated for breast cancer.
So no magic pill in the future, right?
Well, cancer is a different disease in each patient, and you can't really lump all of cancer together. There are many different cell types even that can give rise to different forms of breast cancer within the breast. And so I don't foresee one magic pill dealing with this, but I think that each of our specialties, from surgical oncology to medical oncology and radiation oncology, has made great strides over the last 30 years and will continue to do so.
And talking about strides, I really want to talk a little bit about, spend maybe a minute talking about the Critical Cancer Center of Abbott-Kinney Masonic Hospital. I know many changes have taken place. Can you give us an update as to what's going on there?
Well, we're very fortunate. It's a comprehensive cancer center that has under the same roof surgical oncology, medical oncology, as well as radiation oncology. And so all of the main disciplines that treat cancer are present under the same roof. Before I came for this program, I saw patient for follow-up for her breast cancer. She's doing well, but I was able to see her with other specialists who've also been involved in her care. So, and that enhances communication, so that I was able to speak with her other doctors, examine her, and come up with a nice plan for her, which she can leave the cancer center with. And so I think that that's really good for patients.
Sort of sounds like a Mayo model. Mayo
I
Clinic.
think a Mayo
It's
Clinic
just-
is a wonderful cancer center, and of course it's a good model to shoot for. So, yeah.
So, doctor, what would you leave our viewers with? If you can say any, and you can, you can say anything to them right now.
Well,
What advice would you leave them with?
Well, I think getting informed. Oftentimes there's a fear of cancer, which I think is natural. It's a perfectly natural human emotion. But sometimes fear can prevent us from taking the proper actions that are good for us, and fear can prevent us from getting informed. And I think it's very important to get informed. I use the American Cancer Society website a lot, and that's a good starting point, as is a regular discussion with your primary doctor. You know, we were joking earlier that many of us spend more time taking our car in for that 10,000 mile tune-up, and then the 15,000 mile tune-up, and we don't make it a point to see our general doctor and establish a relationship and let the doctor know if there's something that's bothering us or that we have questions about something. So I think getting informed about illness in general, not just breast cancer, but illness in general, and taking better care of ourselves can lead to good health.
I think it's a good idea just to kind of, if we have our cars scheduled regularly every 3 months and every year for its overhaul completely, it's something we should put on the calendar there as well.
Right.
It's not just the car's overhaul, but it's our overhaul too. And I know that at 20 and 25, we think we can just about do anything and not worry about anything. But after the age of 20, you should start getting those annuals going on. Time goes by so fast, Doctor. It does. I want to thank you again for coming out and thank Advocate Illinois Masonic Hospital and the Criticals Cancer Center, Hispano Care, on behalf of all of us. Thank you for listening. And in closing, I just want to leave you with cancer is complex genetic disease that is different in every patient. And I want to thank you, Dr. Yajnik, for coming out again, and our viewers. On behalf of Hispano Care, Illinois Masonic Hospital, the Criticals Cancer Center at Masonic, thank you very much. Until next time, we'll see you soon.